So good afternoon, Dr. Koski. This is Eli and my Unit 8 assignment behind schedule. So I'm sorry, but this is my video presentation. So if you can just follow along with the slides of my PowerPoint as I narrate and kind of discuss the topics, I think that you'll find it interesting. So moving on to slide 2. So why do we conduct assessments? So for our scenario, Tyler, his name, let me check that, falls behind his peers in speech and language. He can only say 3 words. He refers to himself, instead of using me or words like I, he says Tyler wants. He prefers to point to things that he wants than saying he wants them. And when people can't understand him, he becomes frustrated. And also, he shows some cognitive issues because when he attempts to run, he falls. So we're seeing some developmental delays, I would say. I'm not sure if the DSM would classify this as autism spectrum disorder, but for the purposes of this presentation, we're going to go with that underlying hypothesis, which we will test. In slide 3, the objectives of my assessment is the first is to determine if Tyler has a problem, which we have probable evidence to believe. Uh, the evidence suggests that his language and speech skills are delayed, and we're seeing this developmental delay uh, kind of coinciding with the presence of autism spectrum disorder. In addition, my second goal is to determine if the severity of the problem is very profound and calculating a possible score to indicate the severity using the assessments which I will discuss in slide 3. And the third goal is to develop an intervention plan for Tyler. Excuse me, slide 4. So slide 4, so for this assessment, I opted to use the Clinical Evaluation of Language Fundamentals Preschool assessment. We're going to use it to evaluate Tyler's language and speech skills and identify if indeed he has autism or some other underlying disorder. The test will involve several levels, and the level 1 will focus on sentence structure, word structure, and expressive vocabulary. If we identify a disorder, then we're going to go ahead and do the level 2, 3, and 4, which level 2 looks at how he uses the semantics of the language. Level 3 is how his pragmatic skills are, and level 4 is overt communication behavior. So hopefully this will allow us to identify if he does indeed have a disorder. It's worth mentioning that this examination per Graham et al. 2016 suggests that it's for ages 3 to 6, so it's appropriate for Tyler. And yeah, we'll see. We'll go from here. Slide 5. So slide 5, for the purposes of the assignment, we also prompted to introduce a second course of action. So developmental assessment for young children, second edition, is also a second course of action that we could use. It could be used to help determine if Tyler is below his peers. And the score will be based on observation of the child and an interview with the parents. Items will be scored from pass or fail criteria, 1 being pass, 0 being fail, and the raw scores are converted to normative scores using the appendices within the test. According to Schwartzmiller 2014, this is for children ages 2 to 5, so it's appropriate for Tyler. If we determine that Tyler is significantly below his peers in the 5 domains, then we will look at possibly following those appendices to hone in on the severity of his disorder. But for the purposes of this, again, we're just trying to see, does he have a disorder? In addition to classifying if he has a disorder, slide 6 continues where we talk about the 88 items on the DAISY-2. 78 of those items are for language, 87 of those are for motor and fine motor skills, and 63 of those items concern social emotional development and interaction, and 64 of those items concern if he is able to adapt and specifically we're talking independence and self-help skills. So pretty interesting that it can kind of break down pathological observations into that amount of items so we can hone on what we need to use in his individual intervention plan. So very interesting stuff on slide 6. Slide 7, again, we're also going to look at, once we've identified if he has the disorder, and then if we need to go into the severity of his disorder, we'd also, in slide 7, implement the Autism Rating Scale, 2nd edition, also known as CARS 2. It's one of the psychological tests in the Mental Measurement Yearbook, and it was developed in 2010. It has 2 parts. The ST for children below 6 years, and the second part is the HF for those of above 6 years. Since Tyler's 3, we're going to use the ST version, and it consists of 15 questions. Each question is rated on a scale of 1 to 4, ranging from, let's see what the criteria is, a severely abnormal to normal. For Tyler, score below 30 will indicate if he's non-autistic, 36 will indicate mild to moderate autism, and 37 above will indicate severe autism. So we see consequently, we see kind of the life cycle of diagnosis using various tests. I don't know how cost effective this would be again. We start with classifying autism, looking at the severity of it, and then putting it on a rating scale. In particular, I did enjoy using the CLIF, and then I did see a lot of value, of course, in the CARS assessments. Due to cost effectiveness, I don't know how the DAYC2 would play into this, but hey, I'm open to recommendations, Dr. Koski, so if you have them, please put them in your comments, and I'll be sure to read them. So moving on, slide 8. So the reliability of each test. Studies show that the test-retest reliability and internal consistency across all of the CLEF-2 tests are pretty significant according to WIG et al. 2005. The DAYC2 evidence shows high test-retest reliability, indicating that the test is reliable according to Schwartzmiller 2014. And there's a high degree of internal consistency and reliability with the CARS 2, according to Lee et al. 2023. So again, if we look at the CARS assessment, I think that's one of the ones at the forefront, and it's probably evident by the fact that it's been updated as of this year. But again, that's just some of the reliabilities. Won't go into too much depth there. Next slide, slide 9. The validity of each test. So the evidence indicates that the CLEF-2 test yields significant results for validity on the manner of its internal structure according to WIG et al. 2005. With construct validity is also good for the DAYC2 according to Schwartzmiller 2014. And of course, there's a significant, it's worth mentioning that this evidence suggests it's a significant positive correlation between the instruments and the result of a high level of construct validity, indicating that the CARS 2 is valid as of 2023 by Lee, according to Lee et al. So why is this important, though? Let's see my comments here. It's important because we will want to make sure that the test measures what it claims to measure, and that we support that assertion with valid empirical evidence. And here we're seeing that all 3 of these assessments are valid in terms of how they measure maladaptive behavior, and in particular potential behavior disorders. So it's very important to note that, and I just wanted to go in depth a little bit more with that one, just a little bit more. So slide 10, again, Here are some possible recommendations for Tyler's intervention plan. Again, this is just off what we're given to work. My assessment plan, once we have conducted the assessments, would allow me to make recommendations for Tyler. The CLEF will allow me to make speech therapy recommendations for Tyler because he's shown that poor speech and language delay. That AC2 would allow me to recommend occupational therapy to help with barriers that affect Tyler's physical and cognitive needs, i.e. the fact that he seems to be stumbling when he's running. And the autistic the CARS 2 can allow me to recommend him to follow on psychological services with a clinician or licensed psychologist, such as CBT, parent-mediated therapy, behavior observation, behavior therapy. If the assessment suggests that Tyler doesn't indeed meet the criteria in the DSM-5 for autism spectrum disorder. And of course, slide 11, some of the limitations of my personal assessment plan would be, first, that the valuable tests do not directly lead to the solutions, right? Just because we identify a problem and understand the problem doesn't mean that Tyler's going to respond to the treatment. And so it's going to be a comprehensive assessment where we're implementing solutions, gathering that feedback from his parents and teachers and Tyler if we can, and adjusting the plan to meet his individual development needs. And the second limitation to my individual assessment plan is that Tyler's family and their socioeconomic background may lead to implications with treatment. Again, we don't know how his family will react to the diagnosis or how supportive of the treatment they will be. They could be skeptical, they could be biased, afraid of labeling Tyler, so this could lead to some inaccurate results in our assessments or some limitations in the treatment of Tyler. But overall, those are the big two limitations to this. And the 12th and final slide, again, is just my references page. But in a nutshell, that's it, Dr. Koski. So today I talked about the reasons why we conduct assessments, and specifically for referral, we talked about the objectives of the assessments that I discussed, and finally we talked about the reliability and validity of each test or assessment type, if you will. And we talked about Tyler's individual treatment plan once we have identified the behavior, the troublesome behavior, or the delayed learning, and once we have actually given him a diagnosis, which is very important. So hope you enjoyed this brief presentation, and thank you for your time, Dr. Koski, and your mentorship throughout this term. I've been appreciative of that, and have a good day. Bye-bye.